okay, darling? You look stressed.
My chest hurts. I don't know why. I think my blood pressure's going up. I just don't know why it's keep happening.
Well, have some more Pepsi. And you should get back to the doctor. There's got to be something they can do.
I hope so.
All right, give your honey a hot dog bite.
Is your blood pressure creeping up with each doctor's visit? Have you tried time and time again to change your habits, but nothing seems to work? Are you currently prescribed a blood pressure medication, but it isn't getting the job done on its own? Talk to your doctor about Atenolol. Taking the step to visit your healthcare provider can feel daunting, but it's an important part of managing your health.
James, you look real stressed. Let's go home and get you a hot dog.
Hi, James and Lisa.
Hey, darling.
Hey, let's go take a look at your blood pressure, okay?
Okay.
Hi, James. So I know you've been taking your ACE inhibitor, but your blood pressure is still a little high, so I think we're going to prescribe something else for you.
Okay. Well, what do you suggest, Doc?
Well, I think a good option is Atenolol. It's a
Atenolol?
beta blocker that'll help reduce your blood pressure and keep it in the ideal range. How does that sound?
I think that'll work.
What should we look for when he takes that medication?
So Atenolol blocks certain chemicals in your body that increase your heart rate and your blood pressure. So when you take it, it'll keep your blood pressure and heart rate a little bit lower. So side effects include fatigue, dizziness, and low blood pressure. So you want to make sure you take your blood pressure and watch out for those symptoms so your blood pressure doesn't go too low.
Okay. I think I can do that. Thank you, Dr. McLovin. I just want to feel normal again.
Well, you're normal, honey. Don't you worry.
I thought I was born different, I guess.
You're taking an important step, James. We'll also talk about managing your exercise and your diet as well.
Okay, Doc.
How about hot dogs? How many hot dogs can you have a day?
Atenolol is a cardioselective beta-1 receptor blocker that helps to reduce heart rate and contractility of the heart muscles. It is not typically a first-line drug for hypertension. It is often prescribed in combination with other drugs to achieve desired results, or when a patient has a comorbidity that warrants its prescription, like previous history of a myocardial infarction. Other common indications include angina pectoris, heart failure, and arrhythmias. Atenolol is a pill taken by mouth where the recommended dosage is 50 milligrams daily for hypertension or non-vasospastic angina. You should monitor and log daily blood pressures to determine effectiveness and discuss these results with your doctor. You should take your blood pressure and heart rate before a scheduled dose of Atenolol. If your systolic blood pressure is less than 100 or if your heart rate is less than 60 beats per minute, you should not take your scheduled dose of Atenolol. When taking a scheduled dose, take Atenolol on an empty stomach. If you miss a dose, take the next dose as soon as possible, unless you are less than 8 hours away from your next scheduled dose. Side effects may include hypotension, bradycardia, dizziness, fatigue, and erectile dysfunction. Avoid activities such as operating heavy machinery and change positions slowly until you are familiar with how Atenolol affects you. Discuss all side effects with your healthcare provider. Serious adverse effects include heart arrhythmias, heart failure, and allergic reactions. Do not take Atenolol if you are allergic to it or any of its components. Call 911 if you experience signs of an allergic reaction, such as hives, difficulty breathing, swelling of the face, lips, tongue, or throat. If you experience shortness of breath, leg swelling, severe fatigue, sudden weight gain, or rapid or irregular heartbeats, contact your healthcare provider immediately. If you have diabetes, be sure to carefully monitor your blood sugar levels, as Atenolol can mask the signs of hypoglycemia. Do not stop taking Atenolol without direction from your doctor, as this can cause worsening sudden chest pain. Managing hypertension is a journey. With the right support, treatment, and lifestyle changes, you can take control of your health. Don't hesitate to reach out to your healthcare provider for guidance.
Talk to your healthcare provider today to find out if Atenolol is right for you.